Hello, welcome to Cure Orbit, where we passionately pursue a world free from the fear of heart failure. Millions live stronger, fuller lives despite heart failure. Could you be one of them? Let's break the silence, learn together, and empower your heart. Today on the show, we're diving deep into the topic of heart failure. Heart failure can affect anyone, anywhere, anytime. So understanding its signs, symptoms, and treatments is crucial for all of us. Let's start by busting some myths. What actually is heart failure? Many think it means their heart has stopped beating, but that's not true. It simply means that the heart isn't pumping blood as efficiently as it should. Imagine your heart is a powerful pump that sends blood throughout your body, delivering oxygen and nutrients to every cell. In heart failure, this pump isn't working at its best, but it hasn't stopped. Instead, it's struggling to meet the body's demands. Now, what does that mean for you? It can cause some not-so-good feelings like tiredness, swelling in your legs, and shortness of breath. These symptoms can make everyday tasks tough and put a damper on your energy levels. But here's the silver lining. Heart failure doesn't mean game over. Lots of folks with heart failure live long, active lives with the right care and a positive attitude. So who's at risk of heart failure? Well, if you've got high blood pressure, diabetes, or coronary artery disease, you're in a higher risk zone. Also, if you're packing some extra pounds or have a family history of heart issues, it's worth being extra vigilant. As we get older, the risk of heart failure tends to increase too. But remember, age is just a number, and there's plenty you can do to keep your heart happy and healthy. Let's chat about the different types of heart failure. There are two main types, left-sided and right-sided heart failure. Think of your heart as a two-pump system. Left-sided failure means the left side of the heart isn't pumping as well as it should. This can cause fluid to back up in your lungs, making it harder to breathe. You might find yourself getting short of breath, especially when you're lying down or doing something active. Right-sided failure happens when the right side of the heart isn't pumping properly. When that happens, fluid can back up in your legs, belly, and liver. You might notice swelling in your ankles or feet, and your belly might start to look a bit bigger. Now, these two types can also be categorized into systolic and diastolic failure. Systolic failure happens when your heart's lower chamber, the left ventricle, can't squeeze hard enough to pump blood out. In diastolic failure, the left ventricle can't relax and fill up with blood the way it should. Both types are unique, but both need attention and proper care. It's important to know the warning signs of heart failure. We're talking about shortness of breath, fatigue or tiredness, swelling in your legs, ankles, or feet, weight gain from fluid retention, a persistent cough or wheezing, a rapid or irregular heartbeat, trouble exercising or climbing stairs, and a sudden urge to pee, especially at night. Also, if you've got a loss of appetite, nausea, or chest pain, it's essential to seek medical help. Early detection makes all the difference. So if you notice any of these signs, don't hesitate to reach out to your healthcare provider. Now, when you visit the doctor for heart failure, they'll ask you about your symptoms, do a physical exam, and run some tests. They may order a blood test to measure levels of certain proteins like B-type, natriuretic peptide, or NT-proBNP. These proteins are released when your heart is under stress. An echocardiogram, which uses sound waves to create images of your heart, will be conducted to check your heart's structure and how well it's pumping. A chest X-ray can show if there's fluid buildup in your lungs or if your heart is enlarged. An electrocardiogram or ECG can reveal if you have an irregular heartbeat. If needed, your doctor might perform a stress test, heart MRI, or coronary angiogram to gather even more information. Once your doctor figures out the best course of action, they'll create a treatment plan just for you. Treatment for heart failure aims to ease your symptoms, prevent the condition from worsening, and help you live a better life. It's a collaborative journey between you and your healthcare team. First, your doctor might recommend some lifestyle changes. These could include adopting a low-sodium diet, getting regular exercise, quitting smoking, and drinking less alcohol. If you're feeling a bit overwhelmed, don't worry. Your healthcare team is there to guide you and offer support every step of the way. Next, your doctor might prescribe medication to manage your heart failure. Some commonly used medications are ACE inhibitors or RBS, which relax blood vessels to help blood flow more smoothly and reduce blood pressure. Beta blockers, which slow your heart rate and lower blood pressure, helping your heart work more efficiently. And diuretics, which help your body eliminate excess salt and water, reducing swelling and making breathing easier. Other medications such as aldosterone antagonists or digoxin might be considered based on your specific situation. And newer drugs called scale-2 inhibitors have shown promise for certain patients. In some cases, your doctor might suggest devices to assist your heart. Pacemakers or implanted cardioverter defibrillators, ICDs, can regulate your heartbeat. And for more severe cases, there are valve repair or replacement options or left ventricular assist devices, LVADs, which are mechanical pumps that help support your heart's pumping action. If all else fails, a heart transplant might be a last resort. The key to managing heart failure is to keep a close eye on your symptoms and follow your treatment plan closely. You might feel a bit blue or frustrated at first, but remember to stay positive. With time, you'll get used to your treatment and feel more like yourself. It's also smart to join a cardiac rehabilitation program. These programs offer not just medical guidance, but also emotional support and practical tips on how to handle heart failure in your daily life. As you navigate your heart failure journey, remember you're not alone. Reach out to friends, family, or support groups for emotional support and understanding. Online communities can also be a great resource. Sharing your experiences and learning from others can be incredibly empowering. Taking care of yourself is the best revenge. Stay hopeful, stay active, and stay informed. Every step you take today is paving the way for a brighter, healthier tomorrow. Also, if you're looking for ways to prevent heart failure or slow its progression, you're in the right place. Start by keeping your blood pressure, cholesterol, and diabetes under control, because high blood pressure can force your heart to work harder, straining the heart muscle over time. And high cholesterol can contribute to clogged arteries, restricting blood flow to the heart. Diabetes, on the other hand, can damage your blood vessels, increasing the risk of heart failure. Next, focus on what you eat. A Mediterranean or DASH-style diet rich in fruits, vegetables, whole grains, and lean protein sources is your go-to. These diets are packed with antioxidants, vitamins, and minerals that support overall heart health. Plus, they help maintain healthy blood pressure and reduce inflammation. And let's not forget about physical activity. Aim for at least 150 minutes of moderate-intensity aerobic activity per week. It could be brisk walking, cycling, or swimming. Exercise helps strengthen your heart, improve blood circulation, and maintain healthy blood pressure. If you currently don't engage in regular physical activity, start slow and steady. Even small increases in activity can make a big difference. Don't smoke and limit alcohol intake. Smoking damages your blood vessels, raising blood pressure and increasing the risk of heart disease. Alcohol, on the other hand, can weaken your heart muscle. So kick those bad habits to the curb and watch your heart thank you for it. Finally, stay on top of your health checkups. Even if you're feeling fantastic, regular checkups are crucial. Your doctor can monitor your heart health, adjust your treatment plan if needed, and catch any potential problems early. Remember, heart failure is a challenge, but it's not a dead end. You can live a fulfilling and active life with proper care and a positive mindset. Take charge of your health and don't hold back. The world is still waiting for you to conquer it. Thank you for joining us on this episode of Cure Orbit. If this video helped you, give it a thumbs up and share it with someone who could benefit. And if you haven't already, subscribe to our channel for more insightful health videos. Together, we can break the silence, spread awareness, and empower hearts around the world. Stay strong and healthy. Until next time, take care.